Hey everyone, let's just dive right into this explainer. Did you know the global regenerative medicine market is on track to hit tens of billions of dollars in just a few short years? It's an absolute financial gold rush right now. But look, with that kind of crazy money pouring in, we've got to dissect this rapidly exploding world of stem cell therapy really carefully. Our goal today? We're building a practical survival guide to help you separate the legitimate regenerative medicine from the dangerous marketing hype. If you've been following this space, you know there's just so much noise out there, so we're going to cut right through it using just the facts. With stem cell therapy blowing up the way it is right now, we really have to ask this one absolutely crucial question. How do you actually know what's real and what's incredibly risky? The reality is, this whole space is, well, frankly, poorly understood by a lot of patients. And to make things even more complicated, the science is moving so fast it's practically lapped our regulatory frameworks. It leaves us with this weird Wild West kind of scenario. And because it's not consistently regulated across the board, you're often left to navigate a total minefield of conflicting info all on your own. First up, point number one, not all clinics are equal. Let's establish this right off the bat because it's foundational. Simply offering stem cells absolutely does not mean a clinic is operating safely or ethically. There is a stark line dividing this industry right down the middle. On one side, you've got your reputable providers. These are the clinics sticking strictly to compliant protocols and using high-quality biologics. They do it the right way. So a compliant protocol means they are meticulously tracking every single biological product from a regulated lab straight to the patient. They ensure complete sterility and safety. But then, on the flip side, you have the risky providers. These are the guys cutting dangerous corners, pushing totally unapproved treatments, and advertising wild results they literally cannot guarantee. The difference in patient safety and long-term health outcomes between these two, it is night and day. Okay, moving on to number two, what to watch for. Now that we know the landscape is split, let's put together your personal safety toolkit. We're going to look at the exact baseline criteria you can use to rigorously evaluate any provider. Think of these as your four non-negotiable pillars of a good clinic: sourcing, delivery method, staff training, and hype language. You have to verify all four of these before you ever sit down in a patient chair. Let's start with where the biologic product is actually coming from. Do not be shy about this. Demand to know if their product is US-based and completely traceable to an FDA-registered lab. This matters so much because strict US sterility standards are what protect you from severe infections, whereas some unknown overseas processing, that's a massive gamble. You also really need to verify that the staff is properly trained in regenerative protocols. And delivery method, that's just as critical. Are they injecting into the correct, targeted area, or are they claiming they can cure some complex neurological condition through a simple arm IV that isn't backed by peer-reviewed science at all? Remember, you are your own best advocate here. Which leads us right into that final pillar, hype language. Listen closely to the words they use in their marketing, and especially during your consultation. If the pitch starts sounding like a 2 a.m. infomercial, promising a miracle, a permanent fix, or an overnight cure, honestly, hold onto your wallet and walk away immediately. Reputable clinics are going to focus on ongoing support, the actual biological process, rigorous rehab, and realistic outcomes, never impossible guarantees. That brings us to point number 3, spotting the red flags. We've talked about the gold standard of care, but now it's time to hit the brakes and look at the hazards. Let's look at some explicit warning signs that mean you should run for the hills. If a clinic hands you a super expensive treatment plan but flat out refuses to provide any source documentation for their biologics, no way, walk out. Reputable clinics always use transparent, FDA-registered lab standards. Also, delivery has to match the intended use. If a clinic is hooking every single patient up to the exact same one-size-fits-all IV drip, whether they walked in with an arthritic knee or early-onset dementia, that requires some immediate and serious questioning. And finally, true regenerative care doesn't just end with a quick injection. It absolutely requires follow-up, thorough evaluation, and actual supportive aftercare. I really want to pause on this incredibly clear medical fact right from our source material. And by the way, if you didn't know, exosomes are these tiny little messengers that help cells communicate with each other. Here is the undeniable truth. No stem cell or exosome therapy is currently FDA approved to treat or cure any disease. Boom. So the crucial point is this. If any clinic confidently claims they have an FDA-approved cure for a specific disease, that is a glaring red flag. That's a clinic choosing to operate completely outside of medical reality and regulatory truth. Let's wrap up with number 4, the safe approach. After navigating all that aggressive hype and the very real hazards, how do we actually approach this safely and make an empowering decision? The biggest false promise you can buy into as a patient is viewing regenerative therapy as some kind of magic bullet that's going to fix decades of wear and tear in an instant. That's pure hype. The grounded reality is you have to treat these therapies as just one piece of a much broader, really powerful wellness strategy. The safest clinics prioritize deep patient education, true informed consent, and total transparency about what the science can and cannot actually do. When it's done right, under strict conditions, it can be a highly effective part of your overall health journey. But before you go book any appointments, I want to leave you with a provocative question that kind of complicates everything we just talked about. Are overseas clinics actually better? International options often look incredible on those glossy websites, especially when they promise the exact miracle cures we just learned are huge red flags here. But the truth? They aren't always what they seem, and the lack of oversight can be pretty staggering. But hey, that is a deep dive for another time. Until then, use the survival guide, demand absolute transparency, and protect your health.